Hi, my name's Eve Smith. I'm an Honorary Consultant Paediatric Rheumatologist based in Liverpool and also the Paediatric Co-Chair for the Heberden Committee. So in response to some really valuable feedback that we obtained last year, we've expanded the paediatric content over 2 days. This will allow us to cover much more ground in terms of paediatric content and educational content, but also will help us provide some networking opportunities as well. So on Thursday 25th, we've got some really exciting paediatric content. So there's a couple of special interest groups that will be of interest to the paediatric community, including one on adolescents and also on male fold capillaroscopy. We've got a session that's going to be led by our paediatric rheumatology trainees on complex cases. We've got a lifespan session which goes all the way through early onset systemic onset GIA right through to adult onset disease. And the end of Thursday will be capped off by the Barbara Ansell address delivered by Dr. Madeleine Rooney from Belfast, talking about her vast experience in paediatric rheumatology, followed by 2 networking opportunities, one dedicated to trainees, another one for the whole paediatric rheumatology community. The highest scoring oral abstracts will be presented on Thursday as well. So we've got one looking at B cells in the context of JDM, delivered by the UCL team, another led by Lynn Woolley from Versus Arthritis, talking about patient involvement, and a third talking about the Great Ormond Street experience of systemic GIA over a 20-year period. On Friday, there's 2 special interest groups that are going to be of interest to the paediatric rheumatology community, including one on hypermobility and also one on Trojans. We've got an innovative nurse-led session on the use of technology in paediatric rheumatology. There are a lot of sessions that are particularly of interest to AHPs and nurses. The EATC, the Experimental Arthritis Treatment Centre for Children, is going to talk about their patient-centred research portfolio. There's a session on what happens to children as they become adults with rheumatic diseases. And finally, a session on paediatric skin presentations. The whole of the conference is going to be streamed online, and this is going to be available for 6 months after the conference. This is going to be a really exciting day.